Good evening, dearly beloved sisters. I want to welcome you to another Saturday edition of our Health Forum. It's my joy and my pleasure to see every one of us attend the class today. I want to thank you for staying with us, praying with us, standing by us, and then doing everything within our power, within your power, to ensure that this community is doing well. May God bless you all. May God prosper you, and may God grant you all of your heart desires in your health. So today, without wasting time, I want to quickly give a disclaimer and then share with you who we are, especially for those who are just joining us for the very first time. We This is Tabitha Health and Wellness Health Online Health Forum, where we come together to share. We come together to encourage one another. We also come together to lead and teach other women how to eat, how to live a healthy lifestyle, so that we can have strength and energy to fulfill our God-given purpose on earth. Last week, I started a series on digestive health. Digestive health. I thought within myself, and from a lot of counseling and talking with women and interaction with women, I realized that this is a critical aspect that we should not overlook. And then I thought we should share and also talk to ourselves about this very, very crucial aspect of our health. And because digestive health, it's the foundation of good health, really, because almost all the organs of our body system are carefully and located within our digestive system. Our digestive tract is the liver, the pancreas, the what they call the spleen, the stomach, the duodenum, small intestine, large intestine, all of it, our digestion, the excretion of the waste product, they are all located around this particular system. It is a very critical system of our health journey, that if it's not in place, every other thing will not be in place. If you take care of the colon and the digestive system, you will find out that you are taking care of your health in about 70%, which is huge. So it is something that is very important for us to touch. And a lot of people have these digestive issues, digestive problems, digestive health problems, be it whatever, be it a minor or a chronic one. So is something that we cannot overlook. So let's go into. So today I want to pay attention, and I want to believe that many of us have also gone through the messages of that I dropped on Wednesday. That was meant to be the message for Saturday, but due to circumstance within my power, no, that which is not within my power, I had to reschedule the meeting so that so that you can have the message, and it has also been uploaded. So if you have not listened to it, I want to encourage you to listen to it, because it's like a foundation of what I'll be building on, I'll be sharing today. So again, I want to also say that if you are yet to subscribe to our YouTube channel, please do so. Like the messages and share the teachings there, so that somebody can benefit from the teachings. I want to say a big thank you to all the people who have subscribed already. May God bless you and keep you all. Now, there is a common and a notorious digestive system health problem, and it is called peptic ulcer. Now, I want you to follow me carefully. There's different school of thought, different things that people say around, and some of these things, some of the teachings that we hear, they either positively affect the issue, or also negatively impact the issue. So it is very important for us to have the right information, so that we'll be able to handle issues properly. Like I said, sometimes it may not even be the issue that you have that is a problem. It might just be the approach in addressing the issue that may complicate the matter and make the matter worse. So it's important. Knowledge is very critical. So follow me as we begin to dive into the issue of this ulcer. It is important to share certain information and truth about this particular digestive health disease, so that we can always you can do the right thing and then kick the disease goodbye. Therefore, if you have any medical condition, I want to implore you to see your practitioner, your physician, to diagnose you properly and to give you medical support. This forum teaching does not replace your medical support and medical assistance. We give information, share knowledge on things that can empower you and help you to stay well and to stay healthy. So please, we do not diagnose on this platform. We only give our support as much as we can, and the Lord has been helping us. Before now, there are different school of thoughts about the cause of stomach ulcer. There's so many different school of thought. So, but research has shed more light on the this critical health problem that is plaguing a lot of people. So, what we understand by stomach ulcer, or what comes to your mind when you hear stomach ulcer? And I don't want people to think that certain people are the ones that can come down with stomach ulcer. Some will say, oh, I don't need this teaching, I don't have ulcer. No, it's for everybody. It's for everybody that needs to understand the purpose and the teaching behind this particular topic. Now, stomach ulcer is called peptic ulcers, okay? And they are digestive system problem. They are called stomach ulcers, and we can also say that we can call them sores. You can say they are sores. These sores develop in the lining of the digestive system, usually in the stomach. Okay, so that's why it's called, stomach ulcer, because it's right in the stomach. So if it's from another angle, we would name it by the place that the ulcer is happening. So some people just think that ulcer generally should always be in the stomach. So there are different parts and different positioning of the organs where it is affected. That's where we coined the name. Coined the name of the ulcer. So now, so many occur or develop in the small intestine as well. In your small intestine, there is the upper part of the small intestine, the beginning part of the small intestine that is attached to the stomach. We call that beginning part is what is called duodenum. So it can also be beginning at the cold tubes. It can also be there where the ulcer is happening. That's why sometimes some people just feel at the upper part of the stomach towards the lower, under the lower breast, if I'm feeling a very, very, very painful pain around that side. It can also develop at the esophagus. Now, esophagus is that tube. That's tube. Okay, so it can develop from the esophagus. Okay, so and the tube that carries your food from your mouth to the stomach, that's the tube. That's one by that next side, that long thing just by the next side, be by the that we have the Adam's apple for the men and all of that. Okay, so now simple illustration. I want us to follow this. A simple illustration of ulcer is this. Ulcers are from Ulcers are formed from the following things that happen. Okay, so if this particular things that we'll be mentioning happen to us, or it might trigger ulcer. The first one is gastric acids excess gastric acid. It could also be bacteria. Okay, it could also be drugs like non-steroidal anti-inflammatory drugs. So I will give that. It could also be toxins, dirty things colon disturbance and all of that. Since clogging our stomach could be part of them. Now, when any of this combination comes up, maybe 2 or 3 of them above happen, they cause damage, okay, and they cause a small openings or perforation. I call it perforation or small opening. Let me just say perforation, or you could call it small opening. Perforation to the mucosa. So there is something they call mucosa, and the mucosa is the tissue that lines the stomach, okay, duodenum or organs. So let me just bring it this small time. Let me call it like a mucus, or it is something lining that covers a particular surface. Now you want to protect. It's a protective stuff that God put there by himself. So just imagine this. Imagine a damage or a perforation affecting a protective layer or covering. This will result to exposure. It will result to exposure. So this is a simple that I want to do. So mucosa is like mucus, like a lining, is a lining. So let me give an example for us women that wear skirts and all of that. Some of the materials that we buy, they are very, very transparent. And what do our tailor our tailor will now put a lining, okay, a thick lining, depending on the kind of material. If it's a very transparent one, the laces and all of that, they want to put something to cover it up so that your boobs and everything is not exposed. So now imagine if there's a tear or there's something happens to that particular lining. That means that everyone can see what you are covering. The clothes is meant to cover us. Meanwhile, when the lining is not properly, or is torn or is perforated or injured, something happens to it or is rough or is torn, then our body will be exposed. So that's the simple way I want to try to illustrate it. So when someone has ulcer, it means the hydrochloric acid and the pepsin. So it's not a rocket science. I just want us to just listen and just take it, just assimilate it. There's something we call HCl, hydrochloric acid. It's actually acid, stomach acid. They call it stomach acid. It's very strong, very, very, very strong acid indeed. That's why if we ask people who have ulcer, they will explain to you how bad that can be. Now, hydrochloric acid and pepsin. Pepsin is the enzyme that helps to digest protein. So they are not there by mistake. They are there for a purpose, to achieve certain purpose. And this purpose, they must be achieved. If not, we all will not be living healthy, will not be well. So now, when this organ build up, there's a build up, and then in this there's a buildup of the hydrochloric acid and the pepsin, a buildup and destroy part of the lining of the GI tract. So it is possible for that thing to also cause a problem. The acid there, the pepsin there, that is very harsh and strong, it's possible for it to cause a problem with the lining. Okay, so the damage. And so what happens? It destroyed a part of the lining of the gastrointestinal tract. That's the stomach digestive system as well. So I'm just using different words. So the stomach is like a chamber. The stomach is created by God to help to manage the acid, the pepsin. So they are there. So the stomach is one that that accommodates the acid and the pepsin by creating a thick mucus. So the stomach cannot just only accommodate it, because the acid is very strong, the pepsin is very strong. So what happens? So there's a mucosa that is coating the lining of the stomach, coating the lining, so that the impact of this strong acid and this enzyme, the pepsin enzyme, it will not damage the stomach. You see how brilliant our God is. So he's intentional. He knows that you need the acid and the pepsin to break down your food, because without them, your food cannot be broken down. Your solid, your food, your rice and all of that cannot be broken down. So you need that acid, you need that one to break down those animal protein and all the other proteins that you eat. It is necessary. So now, so when this is happening, So the stomach lining is covered. So I call it like maybe like a soothing balm. I call it a soothing balm that just coat it so that it will not be harsh, a reaction that will be harsh on your part. So between the stomach lining and the acid inside the stomach. Okay. So the mucous lining or coating usually produces certain chemicals. So the mucous lining itself, it will produce some chemicals that will be helping to manage the environment as well. It will be producing it. It will help to manage the cells, the circulatory system, cell renewal, renew the cells and help and all of that. So when this happen, but sometimes this processes might be altered. When anything that I will mention later can alter the processes, then it means that there will be an alteration. There's an alteration that happens, and the lining of that GI tract, the lining, that mucosa of the GI tract becomes exposed, which is not so from the beginning of creation. So certain things that we do begin to affect that place and begin to give it an opening. And so that's just a simple illustration. I'm just hoping that somebody is able to get and grab what I just shared. Now, people ask this general question: do ulcers go away? And I have this to say that there is no incurable disease, there's only incurable people. Just like my mentor will say, it's a quote by Reverend Tony Akeyemi, that incurable people is what is common, but incurable disease is not common, because God is the creator of the body and he knows how to restore it. Our body is actually created to renew and to rejuvenate itself, to restore itself and to rebuild itself. So now research shows that making changes to our diet plus reducing stress and inflammation can help to reduce the chances of us developing stomach ulcer from the beginning. Okay, so we can't say that some of the things that can cause it, if you are able to avoid them, automatically we won't come down with stomach ulcer. Okay, so now let's quickly look at the types of ulcer, because we all hear ulcer. Let's look at what type of ulcers do we have. We have the duodenal ulcers. This duodenal ulcer happens when I said, the upper part, the beginning part of the stomach, after the part of the small intestine after the stomach, that's where the duodenum is located. And this particular duodenum plays a very vital role. The bile is deposited. There's so many things that it needs for further breaking down of your food are deposited in that duodenum. And if there's a problem in that place, it can create unpleasant experience and cause problem there and develop ulcer and develop a sore as well, just like what I've explained before. That particular scenario too can happen within this duodenum. Now another one is esophageal ulcers. So you see that pipe that goes, sometimes some people feel that sharp penny vein, they say it rolls to their throats, to their chest and all of that. So that is what they call esophageal ulcer, the sore that is created that, because the mucosa are almost in every part of our body, our organs, helping to protect. It's a protective lining that happens almost all over our body system. So now, if there's any alteration of perforation, that will create a sore, and that is ulcer. Then the other one is bleeding ulcers. Also, unresolved ulcers can start bleeding. Okay, when the ulcers are not properly taken care of, they're not healing and all of they did not heal well, or there are certain things trigger the exposure, trigger the sore to begin to get bad, to get worse, then you start experiencing bleeding, which causes a complication. So bleeding ulcers are considered the most dangerous of all. Bleeding internally can also contribute to ulcers when there's the broken blood vessels in your stomach or in the small intestine. So we need to work on that very well. Then gastric ulcers. In some people with ulcers, there's an increase in the amount of hyperactivity of the gastric juices. So you see the gastric juices inside your stomach begin to work, extra work, hyper working. Okay, like some of the things that we mentioned before, inflammation can make them to hyperwork, stress can make them to begin to hyperwork and begin to release it. Or sometimes when your stomach is also empty or you're not doing the right thing, or you have so many junky stuff there, it can also aggravate these gastric juices to begin to malfunction. So gastric ulcers are another name to describe small openings in the stomach lining that lead to stomach ulcers formation. Okay, so let's quickly go to what are the causes and the risk factor that of ulcer. Okay, so in fact, sometimes when you tell some people that, oh, you have H. pylori, they say, it's normal now. They said a lot of people have H. pylori, a high level of people have H. pylori. So in that case, whether the H. pylori is going to cause problem or not is uh, is um, is a is as a it's not going to be maybe because H. pylori is there, right? It might be due to some factors, okay, that might trigger the H. pylori creating problems. So whether it can cause the problem or not, it's all dependent on certain factors, and I want to mention these factors. One is hygiene. If the hygiene is poor, toilet using and so many things like that, coming in contact with the things that can cause problems, that can reinfect, these are likely that these can cause problems in our body system. When there's an imbalance as well, it can cause problem. The probiotics, when it's missing, it can cause problems for them. Now, it is some of the factors are also stress. People don't know that stress trigger their ulcer attack. Stress, a lot of people are stressed out. Before you know what is happening, they'll say, oh, I've seen some people tell me, I'm eating the way Tabitha said we should be eating, and I'm still having this particular issue. That's why we shared about principles of healthy living lifestyle, and healthy eating is just one of the principles. Another principle is managing stress. So if you manage stress properly in combination with your healthy food selection, then you'll be able to achieve results. There is no there's no way, no two ways about it. You can't recover from health issues when you are not practicing, you're not doing the right thing. So when people say, oh, I'm doing all this habitat thing, in fact, everything I'm doing, I'm not getting results, or I get results and all of that, that's not true. I disagree with that totally, because you know why I said so? It's not about Tabitha, it's about God's plan. It's about God's plan of nutrition for us. And if you follow anything that God gives to you, you are sure that you are going to have results. So that's my confidence. My confidence is not what I'm saying. My confidence in the fact that God gave us these instructions, and if once you followed God's instruction, you will have results. Okay, so you can't have ulcer and want to deal with ulcer in a very funny way, and you think that the ulcer will go away. It doesn't happen that way. So you want to follow certain processes. If you have high blood pressure, for instance, now you've had high blood pressure for reasons, different reasons causes high blood pressure, and you want the high blood pressure to go in 1 week, 2 weeks, or 1 month. It doesn't work that way. It doesn't work that way. So you need to understand that when you combine the things together, you will have results. It's a sure banker that you will have results, because God is the one behind everything that you are doing. Is the one that gave the instruction to you. He said, I've given you the tree bearing fruits for your food and also for your healing, the leaves and the trees for your healing. So when you do this, first is food. Is your food, is it correct? Are you eating right? Are you doing the right thing? So if you are doing the right thing, you can be sure that God will back up his word with what will result for you. Now, the other thing is, when you are also exposed to contaminated food, it can also cause a trigger. The H. pylori that is just quiet, that is just silent, that is not doing anything there, it can begin to work against you. It's been quiet before, but certain things are contaminated. You've had contact with contaminated food, and then that will be a trigger for the infection to begin to work very mad. Okay. Then the other one is this one, the long-term use of antibiotics. I want to say this one very clearly to everyone. Some people will just ask us, they don't even know why they're having ulcer, and they eat very well. So we have tagged ulcer to if you don't eat, and I'm sure many people will I've had this before. And even if you are saying, I eat well, but yet I came down with ulcer, okay, that is not because you are eating, is not why you did not have ulcer. So I'll just be smiling. because you are not eating. Not eating might just be what can trigger, because now your stomach is empty, so the acid is there. Now its acid is there to begin to manifest and show forth. So that's just the logic of that one. So that's why I say they tell you that don't keep your stomach empty, make sure you are eating something. So some people, they give them biscuit, they say they just put biscuit in their stomach that they can keep. Please don't make that mistake, because that biscuit that you are eating will cause, you might lower it, you might just calm down the acid production. But what happens is that you are aggravating the whole process. After that thing wears out, it comes back again, because it will come back again. Because why? It's an inflammatory thing that you are eating, and inflammation is what is a trigger for ulcer. So you need to be careful what you ingest. Long time use of antibiotics, it's a problem. Now, or we call it non-steroidal anti-inflammatory drugs, okay, NSAID. That's what it's called, non-steroidal anti-inflammatory drugs. Okay, now, so some of these medications or over-the-counter medication, pain reliever, and I see a lot of young ladies who have menstrual pain use many of these strong and hard drugs. See, my daughter, I know when she wants to, she's just tell me she doesn't want to use. She have menstrual pain. She said she doesn't want to use this drug, and she was like, she doesn't. When I told, when she hears me say the effect of using painkillers and all of that, yes, sir, she doesn't want to graduate and start using things that will affect her stomach. Even when she was in secondary school, when she had pain, she go to the clinic, and they want to give her drugs. Sometimes they want to give her injection and all of that. So she started to be that she started feeling some unusual pain in her stomach lining. So we had to make a decision. We said, okay, you know what, we address this thing in the other way. So now you want to be careful with using some of these things. They can help to corrode and remove this lining that we're talking about. Then the use of antibiotics, over long use of antibiotics, and antibiotics, that they have their own effect. That's why many doctors will tell you use this antibiotic for 7 days, some for maybe for some infection they will just say maybe 14 days and all of that. It's not even the best for us to use antibiotics for that long period of time. Yes, but because we are dealing with certain infection, you have to be on them. Okay, you have to be on that milk so that the infection doesn't go and cause problems for you again. So you see, we have to strike a balance here. So you use it, but once you finish using your antibiotics, my advice for everyone is that get a probiotics to use. Probiotics from 10 billion upward, 10 billion strains upward, to start using them, so that it can give a counter effect on the antibiotics, because your antibiotics is fighting both the good bacteria and the bad bacteria in your stomach lining and your digestive system. And after that happens, you are prone to infection, further infection. You are prone to all kinds of things, stomach ulcers and all of that in your, and you won't even know what is happening to you. You just feel you're feeling unwell, you're not feeling very well, because you're feeling dizzy, you're feeling so many things like that. It could just be because there's an imbalance in the good bacteria and the bad bacteria within your system. So now the bad bacteria, they have an upper hand, because the antibiotics, in the course of trying to eradicate the bad bacteria, it will also destroy the good bacteria. And mind you, these germs, these organisms, they are doing amazing, fantastic work. In fact, there's a book I read that says that some of the organisms that we have in our stomachs, sometimes we calculate them to be even be more or equal to the number of cells we have in our body system. Is that huge? So long use of antibiotics is something that we should be cautious about. And if you have to use antibiotics, please use it, and then make sure that you take the necessary precautions after. And then you can also get your probiotics from unsweetened yogurt. Make sure that it's a yogurt that have active culture inside, to help to restore. The apple cider vinegar too is another one. It's fermented. You can put it in warm water, and drink every morning. That's another part as well. Then we also have the next one. We have a low immunity. If you have low immunity, you can be prone to what? To ulcer. Because you know what? If it's H. pylori we have a upper hand, and then it should break your immune system down, and that will be a problem. So please, we want to be sure to take care of this particular your immune system. Make sure you are doing the right thing to build your immune system. All your fruits that your friend go to place for your immune system, fruits, vegetables, proteins, plant proteins, and animal protein for no in a moderation, they are you're good to go for that. People say a lot of things about the causes of ulcer, but over time, research have begun to unfold and show to halt different kind of things that can cause ulcer. So let us look at the most common things that can cause stomach ulcer. So now, the first one is the ulcer can be caused by infection in the digestive system, and this infection are caused by the bacteria called H. pylori. Helicobacter pylori is one bacteria that can infect the stomach lining, the processes that we discussed before. It can alter the change, it can alter the entire composition, it can alter everything, cause inflammation, lower the immune system, begin to how bacteria behaves. So when the there's an imbalance in the stomach lining as well, in the stomach as well, in the digestive system, it can create that kind of opportunity as well, okay, for the H. pylori to develop. So in fact, some studies also show that H. pylori is found in over 60% of older patients. Whether the next one is another thing is that being a woman too make us very prone to ulcer. Women are likely to have ulcers than men, especially if they are over the age of 70, and these people also take over the counter medication drugs for a long period of time regularly. I have seen a lot of older people, they subject their body to painkillers, pain relief, and all of that. And when they continue to do this, it will affect them significantly. Okay? And that is going to be a big problem, because that's maybe one of the things that are giving their immune system is low, and then the activity level is very low as well. So when you give them this sort of things, it can also affect them significantly. I want to be I've seen a lot of issues like this that the people they just come down with. So that's why I'm saying that it's not only for people who have ulcers away. Sometimes some people you can develop ulcer anytime, but if you take precaution, you will see that you will guide against it, and then you won't come down with ulcer. Smoking of cigarettes and excessive use of alcohol is also a problem here. Smoking of cigarettes is also a problem here. And for this smoking of cigarettes, I don't want us to make mistakes that it's only those who smoke the cigarette. The secondary smokers too also they are corporate. We have to be careful when people are smoking around us. We must make sure that we caution them, or we stay completely away from that environment. It's very dangerous. The secondary smoker is actually worse than the primary smoker. So you just have to be careful. I've seen people, pregnant women who who had miscarriages because they stay with bosses who smoke in the office and all of that. So it's really really a serious case, and you just see smoke everywhere, and then you too you are ailing, and it's also affecting you as much as it's affecting the person that is a primary smoker as well. So we need to be cautious about this particular aspect of our health, so that we can bid ulcer goodbye, and we can prevent it from happening completely. Now we also want to talk about family history. Some people have family histories, as ulcers also seem to run in the family. Some people will have them, but we have talked about these genetic things. If you are able to take the necessary precautions, even though it runs in the family, you won't come down with it because you decided to take a different look. Some research shows that people who have relatives with stomach ulcers or duodenal ulcers are 2 times or 3 times likely likely to come down with this kind of this ulcer as well. Older age when you get older, like I said, it's also possible for people who get, because at that point in time the immune system is critically low, and then there's high level of inflammation that raises the risk of them having H. pylori. We said 60 to 70% of people come down with H. pylori. They have H. pylori in their system already. Whether it will now cause problems or not is dependent on the so many factors that I've shared before. So that's one aspect. So infections that can damage the stomach can just spring up like that, and it should be the problem, the beginning of problems for us. Now I think this is where we're going to stop the class today. We still have a whole lot to share about, so please digest all these ones that I've shared with us. You see, I don't want to rush the class. I want to take them and so that we can go through systems, how to avoid, how to prevent, what remedies we need to use, and all of that. Please digest these ones that we have shared about, and the Lord will help us and see us through this particular menace in the society, by the grace and mercy of God.